Exercises to keep you fit, healthy, and safe at age 40, 50, and beyond by Dr. Mary Breckel. What's the difference between physical activity and exercise? And what are the few key exercises that address the most common issues associated with aging? We all know that exercise is a key component of a healthy lifestyle. Unfortunately, few of us know what we should actually be doing for exercise to support successful aging or have the time to keep up with a well-rounded routine. We need to train many muscle groups to stay fit, including the arms, shoulders, abdominals, back, hips, and legs. We also need to keep our sensory system sharp, such as our vision, inner ear equilibrium, touch receptors, and body positioning sensors. As a physical therapist specializing in chronic health conditions, aging, and wellness, I have seen just how powerful a small dose of exercise can be to decrease a person's risk of injury and disease progression throughout the lifespan. This article will provide education on types of exercise that contribute to a well-balanced fitness plan and introduce you to a 4 multi-purpose exercise you can do today to stay fit, healthy, and safe as you age. The Department of Health and American College of Sports Medicine recommend that all adults meet the following exercise guidelines. Aerobic exercise, 150 to 300 minutes per week at moderate intensity or 75 to 150 minutes per week at high intensity. Strength training, all major muscle groups 2 to 3 times per week. Flexibility training, all major muscle groups 2 to 3 times per week. Balance and coordination training, varied activities 2 to 3 times per week. Engage in physical leisure activities to avoid sedentary. Let's dive into more detail on each category. Aerobic exercise. The talk test can help you decide whether you are doing light, moderate, or vigorous cardio. If you can carry on a conversation as you exercise, you're doing light physical activity. If you can speak in a sentence or two at a time, but wouldn't be able to sing, you're doing moderate cardio. If you're breathing heavily and can only speak a few words at a time, you are doing vigorous cardio. I'm looking at you, spin class. Cardio becomes aerobic exercise when sustained for at least 10 consecutive minutes. This means that yard work alternating between vigorous and easy duties is a physical leisure activity more so than an aerobic exercise. The ideal type of cardio I recommend for aging adults is walking outdoors on varied surfaces. Walking outdoors is low impact, good for the arthritis, weight bearing, good for bone density, can be progressed with a weighted vest or heels as your fitness level improves and involves moving through natural environments, which boosts mental health and sharpness balance systems. Strength training. Strength exercise help to combat age-related sarcopenia, a fancy term for muscle atrophy. We lose 5% of our muscle mass each year if we don't do strengthening. Regular exercise slows muscle loss to about 1% per year. Muscles need to be trained up to the point of overload, which involves muscle fatigue, burning, or compensations. Ordinary people and healthcare professionals tend to underdose strengthening exercises. Whether you lift weights, use resistance bands, or position your body weight against gravity for load, you should reach fatigue by the third set of 12 reps at the very latest, taking a minute to rest breaks between sets. If you're able to continue reps beyond that limit, you're toning muscles, but not strengthening. Remember to hydrate and rest for at least 48 hours between training sessions per muscle. Flexibility training. Stretching and mobility exercises improve muscle and joint flexibility, supporting upright body alignment and ease of movement. Research shows that slow static stretching, not bouncing, creates the best long-term results. Aim for 1 minute per stretch, broken up into shorter bouts as needed. such as 2 rounds of 30 seconds. Results also improve by stretching while muscles are warm, after cardio, not before, and incorporating deep breathing. Balance and coordination training. This is the most ignored form of exercise, but it is crucial to keep us safe and healthy as we age. A variety of activities should be performed, including static poses, such as standing on one leg, and dynamic movements, such as walking heel to toe as if on a tightrope. Mixing it up by closing your eyes, shaking or nodding your head, or standing on something squishy ensures that all balance systems are utilized. Choose activities that are safe but challenging. Ideally, you'll sway and wiggle a bit and even need to take an occasional corrective step to recover. Tai Chi is the top evidence-based form of balance training to lower risk fall. Physical leisure activities. Aside from structured exercise, staying active with daily movements, hobbies, and chores is very beneficial compared to a sedentary lifestyle. Parking farther away, using the stairs, and walking to the mailbox are examples of how to integrate movement into your life. While moving is important, adequate rest and relaxation are also key components of wellness and reduce the risk of chronic pain. As a physical therapist, I've evaluated thousands of patients. There are certain muscle groups and balance systems that are problem areas for almost everyone who walks in the door. Even very fit people become injured due to repeated position and movements that are part of today's modern life and conflict with our innate anatomical design. It only makes sense to prioritize these key vulnerable areas if you want to narrow your focus and get moving. Here are some functional dynamic exercises my co-workers and I create to keep our bodies functioning well, based on the most common issues we see as people age. I hope you have fun trying these movements. Remember to find a safe place to move, listen to your body, and follow up with your care team if you have any difficulty and want professional help. Mary Breckel is a physical therapist at Jefferson Healthcare who has a special interest in chronic conditions, including persistent pain, osteoporosis, and functional decline that occurs in the presence of aging.